Thank you so much for joining me. Today we are going through another article. So, in this article series, just to explain shortly, I basically just pick articles that I find online and go through them with you. Just let you know what I think about it and hopefully get to hear what you think about these articles as well. Also, I think that some articles are really important and I hope that other people get to hear them as well or, get to know about them. And I think this might be one of the ways to spread the word. Otherwise, the links to the article will be in the description below. Also, my affiliate link with Shein will also be in the description below, just so that you guys can have a look at whatever it is that you see me having on. It might just be in that link. Getting into this article. I don't know, I'm a little excited about this one. These are articles that I've never read before, right? I just see a title and be like, hey man, let's get into it. It's by UNICEF South Africa. It is titled or headlined Hashtag on my mind, better mental health for every child in South Africa. Every child deserves to grow up in a loving, nurturing, and safe environment. I don't know why it looks like such a wholesome report or paper. I don't know what to call it. Every child has the right to grow up in a loving, nurturing, and safe environment with supportive relationships and access to quality mental health and psychosocial support. Unfortunately, this is not the case for many children and young people in South Africa. Yes, sad thing. Ugh, unfortunately, man, I didn't even think about it as a right that South African kids have the right to a safe environment, supportive relationships, loving and nurturing, access to quality mental health support. I didn't even think about it as a right, the way it's not as out there in terms of. Okay, let's continue. Children and adolescents face numerous challenges, including individual, social, and environmental factors that impact their well being. Not feeling safe, exposure to high levels of community violence, child maltreatment, and gender based violence are some of the factors that have a significant impact on the well being of children and adolescents. Oh man, I think, and I worry about teachers the most in this type of thing. I think they're the ones that are probably dealing with this a lot. Because I've seen that with speaking to some clients that are teachers or were teachers, and this has been since I've started in this work, like 10 years of different clients in the industry of teaching, and how they get to see it, man. They get to see these kids that are angry and hurt and coming from very weird backgrounds, gender based violence, child maltreatment, community violence, things they cannot run away from that affect them and affect them badly. And okay, COVID-19 pandemic increased the mental health burden that young people face. A U report, South Africa poll in AU report, South Africa poll in 2022 found that some 73% of children and young people felt they needed mental health support in 2022. Ooh, one thing about children, they will tell you. One thing about kids, they will tell you. They will tell you. It will then go according to the adults in the environment if they're hearing them or not. Hearing and listening. But otherwise, these kids will tell you. The distribution of young people's you the distribution of young you see the young people we are dealing with. This child has a voice I would not be able to. You? The distribution of young people's routines, education, recreation, as well as concern for family income and health has left many young people feeling afraid, angry, depressed, and anxious about the future. The disruption of young people's routines, education, recreation, as well as concern for family income and health. Oh, I feel so horrible for babies that have to, for kids that have to worry about family income and family health. And hey, if it was up to me as a child, you just try to make sure that they never know or they never see. And you do it to the best of your ability, but like kids be knowing everything, man. Has left many young people feeling afraid, angry, depressed, and anxious about the future. I feel sorry for the babies. While the mental health crisis is critical, there are some reasons for hope. Okay. The same U Report poll found that 38% of those who felt they needed mental health support actively sought out help. Listen, you see children have take me, take me children, it's okay. Like, I understand. Like kids, guys, kids, listen here. The bargain is bargaining. The principle is function. Sought help, and a further 67% of respondents stepped up to support a friend's mental well-being. Listen, I knew this was going to be a wholesome one. I knew this was going to be a wholesome. A key pillar that guides UNICEF's work in South Africa is a commitment to ending all forms of violence, from preventing and early intervention to improving the mental and physical well being of young people. Parenting programs and early childhood development form a core part of the response to give every child the best start in life. This page aims to support you across four areas of action: seeking help, shifting the narrative, understanding, and having the conversation. Seeking help, the first step, and sometimes we need a little encouragement to take it. Who wrote this? Who's Hey man, okay. Being aware of when you need support and knowing where to go for help is the first step. UNICEF, with support from Meta, ran a 2023 mental health campaign on Facebook that reached more than 17.5 million people in South Africa with coping tips and the counseling service contact numbers for our partner Childline, as well as the South African Depression and Anxiety Group SADC. And then they have a link that you can click on written where to get help now. So I think this article would be an amazing one to just please read this article on your own after this. Please do. Shifting the narrative, supporting young people to lead the mental health conversation. Okay. With our partner, Radio Workshop, we trained 100 and Radio Workshop. Radio Workshop. Okay. We trained 117 youth reporters across 9 sites on radio fundamentals and mental health. Youth reporters are leading the mental health conversation through the live radio shows and outreach. Yes. Yes, yes, yes. Love it for the babies or the youth. Okay, fine. Youth, then I'm still under that department. I think. When does youth end? 35, ne? Yeah, so I'm still somewhere. A youth reporter says, growing up in a black community, I had to denounce. Oh, guys. I had to denounce the men don't cry words from my system. And that helped let go of a lot of past pains I had bottled up inside. Woo! Guys, having the conversation. Let's have that. I think I'm gonna end it after this part. Having the conversation, helping schools and communities to talk about mental health, what it is, and what parents and caregivers can do to support the young people in their lives. Check, connect, care. This program focused on a mental health project with the school community in the Eastern Cape. Okay, the Check Connect and Care materials were used to train 39 facilitators from 24 schools and helped parents, caregivers, and community members to understand more about the mental health difficulties that their children experience and what they can do to help. I find this so important and so helpful. It's not always really that parents are just neglectful. Sometimes they just don't know or they don't understand. Or if they know and they see it and they understand, they don't know how to help. And this type of initiative, brilliant, brilliant, brilliant. Mental health dialogues engage children, teachers, and parents to open up discussions about the mental health challenges that young people face and how adults in the community can support. The dialogue resources contain fun filled activities designed to encourage people to explore how they can care for one another and how they can identify and look after their own mental well being. Super cute. I need to work with UNICEF one day. Please read this article. Maybe you'll get the same emotions that I've been going through over here. But yeah, that's the end of the article. Thank you so much for listening and for joining me in this conversation. I hope you did enjoy it. If you did, please like the video so that YouTube can make sure that other people are also seeing it, can recommend it to other people so they can also see it, and subscribe. Subscribe. After we get to 1,000 subscribers, I'm gonna stop telling you about subscribing. Don't worry. We're just doing this until 1,000 subscribers, right? And then from there, like, we're good. Don't mind me. I'll see you in the next video.